I think it's something which people are starting to address in medical education. I think it's becoming something that universities are becoming more aware of. And I think the whole way that medicine is taught is trying to move away from this kind of traditional paternalistic structure and understand medicine as more of a social construct, trying to kind of adopt patient-centered care as opposed to doctor-centered care. But I think it's still in its infancy, and it's something that people are still exploring and trying to fit into the existing structures of education and practice. So I think at the university level, it's something which is just beginning to kind of happen in a real way. During my foundation training, which is the first 2 years of being a doctor, we had some really useful insights from some of the psychiatrists who help the medical and surgical doctors to find strategies for care for these people, particularly in hospital settings, and to try and give an understanding of, what some of these people and these patients with complicated medical conditions, what they're experiencing, and how we can work with them to try and help them, because quite often there isn't a concrete solution to kind of fixing these problems, which is what a lot of people are looking for and what a lot of doctors instinctively want to do. So it kind of, to some extent, it does kind of blow our minds, because we're taught about, the body as a complex machine, and when something doesn't fit that stereotype, it's not that we don't want to fix it or can't fix it, but it's just a whole different mindset. So we had some really, really insightful input from one psychiatrist in particular. But it is kind of, it's a little bit of bonus material on top of a curriculum which isn't really kind of skewed in that direction. Because I think, although it's becoming much more recognized, it is still a relative minority group of conditions. Mm-hmm. So I think it's something that that is being recognized slowly, and I think doctors are really grateful for being given those insights, but it's not something which is kind of a core part of the curriculum as I've experienced it so far.